So that's excellent. So thank you very much. As Francis says, we're going to do a double act. So I'll talk for a little bit, then hand over to my colleague Hanne, and then Hanne will hand back to me. And we're going to talk about a new guidance document, and it's addressing ethical issues within a particular type of study, something called a study within a trial. So clearly, the first thing for us to do is say something about what a study within a trial is, and then we can get onto the ethical issues within it. So a study within a trial, a SWAT, is a type of study to generate evidence that will support decisions about trial processes. So for example, how might we best recruit middle-aged men to a trial, or how might we help people to return their questionnaires more effectively? Or what would be the best outcome measure for this particular trial? What do people think is most important? It's a way of providing some evidence to support what I tend to call trial process decisions. And these studies are done within what we call a host randomized trial. So we've been talking a lot throughout this session about randomized trials. A study within a trial would drop into one of those. So we'd be working within a real trial and saying, okay, we're going to give some people this particular participant information leaflet, and we're going to give some people this particular information leaflet. And what we're interested in is understanding. So you do that within the host trial. And we really, really do not want to mess up the host trial. So one of the sort of central features of SWATs is we really don't want to mess up the trial. We need to believe that our intervention, we're uncertain about it, and that it won't adversely affect the scientific integrity of the host trial and certainly not the safety of participants. They're designed for replication, which means we expect to do the same SWAT evaluation multiple times because they're often quite small. They're constrained by the host trial. And this is important. Charles mentioned this in his talk about low risk, and that might allow us to make some decisions that are ethical that would not be the case if the risk was higher. So SWATs are generally considered to be low risk. Now, that always has a judgment that needs to be made case by case, but they're generally considered to be low risk. They are dealt with differently across jurisdictions. So in the UK, we have a particular approach that is different in some important ways to how SWATs are handled in, I know, Canada and Ireland. So it does vary. So we wanted to produce some guidance documents that might start to ask ethical questions, give some guidance, and then provide some potential solutions to how to get answers to those questions. And our main audience is ethics committees and trialists themselves, but clearly there might be others who are interested. And in the red at the bottom, this is a sneak peek because these results that I'm showing you, these are not peer reviewed yet. We've not even shown these to our full list of collaborators yet. So Charles, who gave a talk, he is one of those, and he has not seen these either. So this is a sneak peek. It will show a direction of travel. We also need to do more consultation with public contributors, but it will give you the idea of the direction of travel. And just to give you a very concrete idea of what a SWAT is, this is one myself and colleagues did ages ago. We might think, right, we're going to get a questionnaire. We want our participants to tell us how they're doing. Would it increase the likelihood of our participants sending back that questionnaire if we sent them a card a few weeks before that questionnaire was due, saying, in a few weeks, we're going to send you this questionnaire. It's really important that you return it. We're grateful that you're taking part in the study. Would sending that sort of card increase our response rates? Absolutely plain vanilla, bog standard type of SWOT question. But the potential ethical issues we might consider just in general is, will this mess up the host trial? Clearly, we do not want to sink or compromise the host clinical trial by our question about postcards. So that would be one of a key ethical question to always be asking. Questions around, do we need to get participant consent to send some a postcard and to not send others a postcard. So you can imagine, oh, well, what do we need to do? And also, of course, what are you going to write on that postcard? That also has questions that may require an ethical judgment. What exactly are you going to say? Depending on what you say in the card may or may not make it easier or more appropriate to get approval to go ahead or not. So these are the sorts of issues that these, on the face of it, quite simple studies pose, and jurisdictions might make different ethics committees might make different judgments. As I mentioned, this is one I did, and the evidence so far suggests it's a 3% improvement. It's just a single study. And again, as I mentioned, we want replication studies. So small benefits, they're trying to squeeze out small benefits from host trials. Now, I think at this point, I hand over to Hanne to tell us a little bit about what we did in our study.
Yes, as Shaun said, I'll talk you through what we actually did. So as part of the guidance development, we wanted to know about current practice and issues. And to do this, we looked for randomized SWATs at different stages of the ethics approval process. And we ended with a total of 103 SWATs. So I'll talk you through what the different stages of ethical approval process, what these stages were. So we found 7 of the SWATs that were planned but hadn't been submitted for ethics review yet. These were mainly published SWAT protocols. Through our trial or project team, we found 1 SWAT that had actually been abandoned before being submitted for ethics review. And we found that obviously most of the SWATs that we found, 90, had been reviewed, approved, and actually conducted. And these are your published SWATs in the literature. And also through the team, we found 3 SWATs that had been reviewed, but the researchers decided not to progress them out due to the ethical feedback that they actually got at review. And then also through contacts, or no, this was through the literature actually, sorry. We found 2 that had been abandoned partially, despite the SWAT being ethically approved by a more central committee. These 2 had the issue of sites declining to take part in the SWATs because they thought some part of it was unethical. Next slide, please, Shaun. So from the 103 SWATs that we found, we collected information relating to ethical considerations. So we looked at whether the SWAT had ethical approval, did participants consent to take part, what documentation were they provided with, any considerations for vulnerable participants that were described, or any of the risk of taking part, or confidentiality of participants, issues around that were described. And lastly, we also looked at whether the SWAT team planned to or had shared the results and data. I've highlighted 4 items here, just to remind myself to say that I'll jump a bit in the next slide and talk a bit more about these, because they are relevant to Shaun's next section. Next slide, please, Shaun. Okay, so I thought it would be helpful if you were aware of some of the findings from the SWATs we looked at when you hear more about the guidance that we developed. So out of the 103 included SWATs that we looked at, 17 reported that they had patient and public involvement. Out of the 103 included SWATs, 90 reported that they needed ethical approval. And in case you're wondering, 3 reported that ethical approval was not needed. And for 9 SWATs, there was no detail about the ethical approval whether it was provided or applied for. And obviously one SWAT was not applying for ethical approval, it was abandoned before. And out of the 90 SWATs that reported to need ethical approval, 12 of them reported to actually consent SWAT participants or the legal guardians to take part. And lastly, 7 SWATs reported to have a plan to inform participants of the SWAT results. Next slide, please, Shaun. So in order to learn more about the ethical issues, what the ethical issues are when conducting SWATs, we invited a range of stakeholders to take part in consensus meetings, basically to get a consensus on the issues and possible solutions. So through the project team, we identified some people and invited them directly. We also advertised at a conference and on Twitter. So in total, we had 32 stakeholders from 5 countries, all discussing the ethical conduct of SWATs. Next slide, please, Shaun. So we didn't just throw attendees into these discussions in the consensus meetings. They were introduced to a framework for thinking about ethical issues, consisting of 4 ethical principles that are internationally accepted. Corey has already talked about them in a lot more detail. So apologies for the repetition. I'll keep it very short. In terms of the principle is respect for persons. It's about respecting people's autonomy. Beneficence is about protecting people from harm and promoting their welfare. Justice, which is about treating participants fairly. And respect for communities is basically about respecting the shared social structures, values, beliefs within different groups in society. We also introduced attendees to 2 case studies, SWAT 13, which looked at giving post-trial participant shopping vouchers in order to increase questionnaire return, and SWAT 24, which used a theoretically informed questionnaire cover letter in order to increase questionnaire return. And this was really to help attendees discuss the issues and get them started on a deeper conversation. And back to Shaun.
Thanks, Hannah. So what we did with all of that stuff that we got from the literature, those published SWATs, and all of those discussions with our stakeholders was the next struggle, if you like, was how to pull that information into something that could be useful to our key audiences, which were, I guess, members of ethics committees and trialists, and to collapse it into something that's not going to be so huge that it will be difficult to use, or be clear how they're going to use it. So this, what I'm showing you now, this is the sneak peek. So this is not necessarily the final version, but this is the direction of travel. It's taken actually quite a long time to pull that information into a form where we think, okay, we could see how we were going to use it. And what I'm going to highlight now are 4 components, and then I'm going to give you a few examples. So you don't really need to look at all the detail. I'll give you some examples in a moment. But one of the key things we came up with was these headings. So the first bit is we wanted to focus down on different trial phases, and this is the phase, I guess, of the trial, so a host trial. So I think, okay, what we're doing now, we are planning. We're in the design and planning stage of our trial, and at that phase of our trial, we want to think about the SWOT, and we're thinking about the SWOT stage, if you like. So you could have design, and then we have this first bit where the SWOT team members are coming together and thinking through issues linked to design. Similarly, there might be things where we are at the SWAT stage of thinking about the registration or the submission of ethical approval for our SWAT. So there's trial phase, there's the SWAT stage, and then we've come up with this idea of ethical considerations. So for those things, what are the things, the questions perhaps that a member on an ethics committee could ask, or a trialist could ask themselves? This is an ethical issue at this stage of the SWAT and at this stage of the trial. Have we managed to answer that question in a way that makes us and others feel comfortable? So we're trying to set things in a way that's about questions that people can ask. And then finally, we have tried to provide some actions and solutions. And when I say we, what I mean is the review material that we found, and in particular, the stakeholder discussion. So the ethical considerations were raised in our literature study, but also, of course, by our stakeholders, and then also provided some solutions. So they're the 4 chunks that we have right now. There's something about the trial, the host trial phase, the SWAT stage, questions we need to ask at this point in our trial and SWAT, and how might we answer and resolve those issues. So thinking about the trial stages, then there are 5 that we broke it down to. Of course, there might be there are plenty of stages within a trial. The point here is that these are the ones that came up in our discussions. So I guess that might suggest that there are things where we don't necessarily think there are particular ethical issues linked to SWATs linked to a trial stage. So, but these are the ones that came out of our discussions and the literature, starting from design right through to the end. So it covers the whole life, but not necessarily all the sub-stages because they didn't come out in the discussions. And the ones that are highlighted in blue are ones that I'm going to give you one example from each of. So just to pick and choose some, to give you a flavor of what we're doing. So this first one, it's at the design stage, and we're thinking, is there resource waste due to developing this intervention? Is there resource waste because we're developing an intervention for groups that are not going to benefit? So this is a question the research team, the SWAT team, would ask itself. And this is really about beneficence. Are we sure that we have sufficient, I guess, equipoise around this intervention, and that we know that it will benefit people or may benefit people or will not benefit people in the way we think? Is it an intervention that is really going to do what we think it will do for the people we think need to benefit, if you like, from this? And one of the real problems with SWATs is that the evidence base for what is and what is not effective is very thin. And yet, of course, for trial processes, we have to do stuff. Like we have to recruit, we have to retain. So there's a lot going on. And we might think we know that it's effective, but actually it may not be effective. So equipoise is actually came out very strongly as a problem within SWAT, something that we need to think about very carefully. And one of the key solutions that our stakeholder groups suggested was around involving public partners in design of SWATs very early, so that the SWAT interventions that are being evaluated and tested are indeed ones that are likely to not lead, for example, to research waste due to developing something that is actually not going to do what we think it does, but also gives us a bit more confidence around the equipoise issues. Are we comfortable in, I guess, if you like, using this with some of our participants, but not others, or with some of our trial team, but not others? So getting public partners was one of the key solutions to give us greater reassurance around that ethical issue. A little bit more on consent. Now, we've talked a lot about consent in this session, and this is another absolutely key area that came out in our discussions. Do we need to always ask our individual participants to consent to the SWAT? And that's a judgment I think we'll always need to make, but the solutions that are suggested here mean that I've suggested in some cases it might not be necessary, and clearly not necessary. Things are happening already, we do stuff, but we're not getting ethical approval for it now. So the SWAT itself doesn't need ethical approval because of the low risk, that sort of proportionality point that is written there, and this belief that the SWAT intervention is low risk. And that is something that needs to be challenged, if you like, tested. Is it really low risk? But that will be the starting point that would enable, in some cases, a comfortable decision, an ethically appropriate decision to not ask individual participants for consent to take part in the SWAT. It's a process that will happen anyway. Let's say it was a newsletter. What we're changing is the format of it, say. So the idea of consent was a key part of our discussion, and certainly varies across jurisdictions as to whether consent is, as we heard from Mary, in many cases legally required, as opposed to there's a sort of public good, public benefit side to it, which might enable us to feel more comfortable in not getting consent. And the last of the examples is around, do we need to tell people about the SWAT, even if they weren't, for example, aware it was happening? So this is a justice issue. And basically the answer is yes. We do need to fully inform participants, even if they were not aware, and perhaps particularly if they're not aware that there was a SWAT going on in the first place. And again, this is information, a solution that has come from our stakeholders and from the review we did. It's what we're being told should be done. So participants on a justice basis need to know that a SWAT has been done, even if they weren't consented. So when the results are available, they need to be told. So in summary, there are some differences between SWATs and other types of study. And one of them is that they are dropped within another. They're a study within a study, and they are designed for replication. So there are some things which we know we won't be able to answer within a single SWAT because we are constrained by that host trial. Ethical approaches vary across jurisdictions, and we hope that our guidance, once it's finished, will provide some questions that could be asked both by ethics committees and trialists themselves, and that some solutions might be provided to. And as I say, the guidance document is coming later this year. And that's it. So thank you very much for your attention.